Hey, it's me, Dr. Daniel, with drdaniel.com, and today I wanted to talk a little bit about vitamin D deficiency. About 9 out of 10 of every patient that I test, I will find that they are vitamin D deficient, which is pretty shocking because I live in Austin, Texas, and we're definitely one of the places where you're going to get more sunshine than other places. And still, 90% or more of my patients are deficient in vitamin D, which is pretty interesting. Now, what are some signs of vitamin D deficiency? Well, they're pretty vast because vitamin D, which is actually a hormone, interacts with so many different things in our body. But bone loss or osteoporosis or osteopenia is number one. Another one would be weakness, right? Loss of strength. Anxiety and depression is actually a really big one. So mood fluctuations, right? Fatigue. So I work with a lot of athletes and I find that a lot of them will say, yeah, over the last few months, I've noticed that my endurance is decreasing. So loss of endurance or fatigue. Other things would be things like chronic pain, right? Joint pain, muscle pain. Other things which are really important and most people never think about when they're struggling with these issues would be something like fertility or hormone imbalance. And it could be something as simple as vitamin D. So because of the symptoms, I certainly believe that it's best to test and not guess with your levels. And it's very easy to actually do that, to get your blood tested, to see what your number is. And then if you find that you're deficient, well, then address it. And even if you're not having symptoms, if you find the problem, you need to fix it because on the long enough timeline, that's going to start to create problems for you. Now, like I said, I live in Austin, Texas, where we definitely get tons of sunshine. And so why would it be that people are deficient still, right, with sun exposure? Well, the big problem is that most people are not walking around naked, right? Well, at least most people are not. I mean, some people are here in Austin. But the fact is that we need to be getting more surface area exposure if you want to use the sunshine as the primary way of getting your vitamin D, which definitely that's the best way to do it. But if you're going to do that, then like I said, wearing a t-shirt and only getting your arms exposed, that's not enough. Right? You need to be getting full truncal exposure if you want to get it. So sunbathing maybe in your backyard, in a bathing suit or at a pool where you're getting full body exposure, that's going to be your best bet. Other things are going to be, say, like your diet, right? There's bromides or bromines that are very common in foods that also contain gluten, right? So like bread products. Bromine will block the absorption of vitamin D. We also know that glyphosate interferes with enzymatic processes that help us to develop vitamin D and to absorb it. And so if you're consuming a poor diet or if you're eating foods that are not organic or have lots of glyphosate or bromines in them, that's going to be an impact, right? So avoiding processed food. Now, to make matters worse, we now know that 65 to 85% of cancers can be avoided if you have optimal vitamin D levels. So if you're consuming foods that are driving down vitamin D and you have low vitamin D, those foods that are bad for you, that we know that cause cancer, and then combining that with low vitamin D, which we also know that cause cancer, that's a pretty big issue, right? So again, if you've never been tested or if you've never been checked, or if you know that you have low vitamin D, you need to be addressing it. And so again, it's really important that you just stay on top of this. It's one of the primary deficiencies that I find across the board in my patients. And so I just thought I'd share this message with you. If you found this information useful, please let me know. You can learn more by following me on Instagram at Dr. Daniel DC, or you can also find me on Facebook /Ask Dr. Daniel DC. Hope you found this information useful, and we'll see you at the next video.